Sabrina Siddiqui at the Wall Street Journal.
Hi, thank you as always for doing the briefing. So given that the Omicron variant compromises the effects of a 2-dose mRNA vaccine and reduces overall protection, I wanted to ask about those who are not eligible for boosters, namely adolescents aged 12 to 15 first started getting the vaccine in May. How confident are we, since they're not eligible for a booster, that that category of adolescents has protection against Omicron? And also, is there any cause for concern that children ages 5 to 11 who are being administered the first round of vaccines would not have sufficient protection against this new variant?
Dr. Fauci.
Well, it's very clear that when you look in general at a population level, that younger individuals have a much more robust immune response than adults, particularly among elderly. So the comparison there is that you would expect a rather substantial power of the immune response. Having said that, we continually look at the durability of response and the level of response in the people that have been followed in the various studies. So this is something that we will continue to examine as to the possibility or necessity of providing boost for that cohort of young people. Thank you.
Next question.
Go to Catherine Bond at Vanity Fair.
Thank you for the briefing and thank you for taking my question. 2 weeks ago, the African Union put out a statement calling on donor countries to no longer send donated COVID vaccine doses that were ad hoc, provided with little notice, and had short shelf lives. They also called on donor countries to include ancillary supplies with those donations, including specialized syringes for the Pfizer doses. My question is, has the White House, in light of this, reconsidered its policy of not including specialized syringes with the Pfizer donations? Or has it made any change to that policy? Thank you.
Well, thanks for the questions. I want to start by saying that the doses that we are sending are not short-lived doses, meaning they have an extended period of shelf life. So that might be happening with other countries' donations, but not with the U.S. donations. And we've sent 320 million doses now to 110 countries, and that's more than every other country in the world combined. And as you know, that's part of an overall commitment of a minimum of 1.2 billion doses donated with no strings attached, and we plan on building on that total across time. I think importantly, the U.S. State Department and USAID are leading the administration's efforts to work to turn vaccines into vaccinations. And that does mean that we need to make sure that there are enough syringes and needles. And our team has been helping with the global effort to ensure that there are the syringes and needles. The AID team and the state team are working to help train health workers to vaccinate people on the ground, run local media campaigns, and also to launch what we've done here, mobile vaccination clinics. Just last week, USAID added $400 million. That brings a total of $1.7 billion for global vaccine readiness. Administrator Power made that announcement last week, and that includes within that 400 efforts to bolster the cold chain storage in various countries, set up field hospitals, train health workers, build data systems, and support campaigns to increase vaccine confidence. So we'll continue to do all we can to support getting vaccines to countries, and then importantly, as you point out, taking vaccines and make sure that they become needles and arms and actual vaccinations, and that includes efforts to support with the needles and syringes needed to do just that. Next question, please.
Go to Jeremy Diamond at CNN.
Hey, thanks very much for doing the briefing. So tomorrow, the Advisory Committee on Immunization Practices is meeting to discuss the Johnson & Johnson vaccine. I'm wondering if Dr. Walensky could say why that meeting was called and whether you believe that the benefits of getting J&J no longer outweigh the risks. And then secondly, given the rapid spread of Omicron, and the data on protection against Omicron from a booster shot versus a 2-dose regimen that Dr. Fauci just presented, isn't it time to change the definition of fully vaccinated to 3 doses? And if not, what more data are you waiting on to make that decision? Thank you.
So Dr. Walensky on the ACIP and then on the definition of fully vaccinated.
Yeah, thank you for that question, Jeremy. So ACIP meets intermittently to review the safety data of all of their vaccines, and I will look forward to their discussions tomorrow and to review of those data and to any recommendations that come thereafter. In terms of the definition of fully vaccinated, as you know, the definition right now is 2 doses of an mRNA vaccine or a single dose of the J&J vaccine. Certainly, as Dr. Fauci has demonstrated, and even our CDC data have also demonstrated, we are continuing to follow that science, and it is literally evolving daily. And as that science evolves, we will continue to review the data and update our recommendations as necessary.
Next question.
All right. Go through a few more. Josh Wingrove at Bloomberg.
Hi there. Thank you so much. Can you give us a sense of what employers and schools should be doing right now? We're seeing a lot of employers put on hold their return to office strategies. We're seeing schools and colleges move to virtual or warn about the need to move to virtual. We're seeing widespread outbreaks in Major League Sports leagues, for instance. Do we think that this is mostly the Delta surge that we're seeing across the Midwest and Northeast, or is this believed to be that plus Omicron? And do you think overall that we need to be, in essence, locking down a little bit again? Should employers, should schools be taking the precautions that we're seeing, or are they overreacting? Thank you.
Dr. Walensky.
Yeah, maybe I'll start, Josh, and just say, our guidance from the CDC has actually been very clear as to what we should be doing in preventing these cases from happening. Of course, as we've been saying, getting vaccinated, getting boosted, especially with emerging data that the boost will really be helpful, both with regard to Delta, but also with regard to Omicron. But also our masking guidance has actually not changed. In areas of substantial or high transmission, we should be having public indoor masking for everyone, vaccinated or unvaccinated. That is 90% of the counties right now. Adding ventilation, adding distancing and hand washing, all of those continue to hold and continue to serve us very well in preventing disease. And we would just encourage local jurisdictions to employ the interventions that we know work.
Yeah, I would just add, consistent with what Dr. Walensky just said, we have the tools to fight this virus, including Omicron, and we're in a very different and stronger place than we were a year ago, and there is no need to lock down. We have effective vaccines, Dr. Fauci just talked about, including against Omicron. We have booster shots for all adults. We have now a vaccine for kids age 5 and 11. That means we now have vaccines for 95% of Americans. We know how to keep our kids in school and our businesses open, and we're not going to shut down our economy in any way. We're going to keep our schools and our businesses open. Next question.
Go to Serena Marshall at Now This News.
Thank you so much for doing this. I was wondering more widespread.
Hey, Serena, you're cutting out.
We're having trouble hearing you.
Hey, Serena, we'll just get back to you. Let's go ahead and go to our last question. Let's go to Brenda Goodman at WebMD.
Can you hear me? Can you hear me now?
Yes.
Americans are really tired, and there's kind of a feeling of exhaustion out there from people that I'm talking to. We're heading into our 3rd year, and Omicron is just right around the corner, and I think people are trying to read a really confusing set of tea leaves. It's more transmissible. The illness it causes may be less severe, particularly if you have some kind of underlying immunity. So given all this complex stew of factors, and I know you've been looking at all of them, how worried should Americans be about Omicron, which is, could be causing a surge we've heard around, January or so?
Dr. Fauci?
Yeah, well, again, getting back to the theme that we have all been underscoring, if you are unvaccinated, you are very vulnerable, not only to the existing Delta surge that we are experiencing, but also to Omicron. And when you hear about Omicron being less severe or not, and you hear about those other things, it doesn't matter. If you are unvaccinated, you need to get vaccinated to diminish your vulnerability. And if you are vaccinated, to get boosted. It is very difficult to predict, as you say, to read the tea leaves. So if you can't read the tea leaves accurately, then do the things that we've been recommending. All of the recommendations from the CDC about prudence and wearing masks in indoor crowded places that are public settings, but also continue to understand the importance for yourselves and your families and your community of getting vaccinated. Those are the tools we have. If we didn't have these tools, I would be telling you to really, really be worried. But we have tools. So get vaccinated, get boosted, and the alleviation of the concern, even though we take all of this very seriously. Back to you, Jeff.
Good. Well, thank you, everybody. We look forward to the next briefing.